transfusions. All right. So we have standard transfusions, where if I'm going to receive blood, I get it from somebody else that matches my blood, and that's how it is. We also have autologous transfusions. Autologous means that the patient donates his or her blood to themselves. So they do it about 6 weeks before the procedure that they're expecting. This can be done for like Jehovah's Witnesses. And it's their own blood that's being utilized to reestablish blood supply to the body because they don't want to use somebody else's. Again, Jehovah's Witnesses would be an example of them using autologous if that's the way they decide to go. Then you also have intraoperative transfusions. Oh, and by the way, all this stuff, guys, is from ATI. So that's where I'm getting it from. Intraoperative transfusions is for people that while they're in surgery, they anticipate they're going to lose blood. And we have a special device with a little funnel that collects the blood, and we have up to 6 hours to retransfuse the blood to that patient. Okay, we can give packed red blood cells. You will have to administer it within 30 minutes after retrieval from the cooler, the refrigerator. We have the supplies. We have to have a Y tube. We have to administer within 3 to 4 hours. 4 hours for older people because they have a harder time dealing with the excessive fluid volume that's coming into their body. They don't deal with it as well. So that's why for older adults, probably more 4 hours. Regular person 3, but 3 to 4 hours is fine. Platelet transfusions, no blood type for this one or no cross match. Infused immediately over 15 to 30 minutes with a small filter and short tubing. And then we also have the plasma transfusion. Remember, plasma is rich in clotting factor. It's known as cryoprecipitate. So we give those for people that have like hemophilia, von Willebrand's disease, disseminated intravascular coagulation, any condition where they don't have clotting factors. And so that transfusion is administered rapidly after thawing because it's frozen, fresh frozen plasma. We give it over 30 to 60 minutes using a regular Y or straight filtering tube. We could also do white blood cell transfusion. That's for people that don't have white blood cells, myelosuppression, bone marrow suppression. If receiving amphotericin B, this is an antibiotic. So if the patient who needs white blood cell transfusion, if they were receiving this antibiotic, which they very well might be because they're at risk for infection, right? We might give it prophylactically. Allow 4 to 6 hours before the transfusion, because when you have too much of that antibiotic in the system and it mixes with the blood transfusion, with the white blood cells, it may cause hemolysis, destruction of the blood cells. So you have to wait at least 4 to 6 hours before you transfuse the blood after administering amphotericin B. And we do a blood type and cross match, which is assess the blood type, assess the RH factor, make sure that they match accordingly. Your needle size, 18 to 20 gauge needle. You want to have normal saline with you. The blood bags of RBCs, usually 300 mLs. So that's what you want to have, or whatever other bag. I don't know the volumes for those. You want to have your white tubing and with a filter as well to make sure that none of the impurities go into the system. Remember to always verify the blood transfusion ID, with another licensed nurse. You assess pre-procedure vital signs to establish a baseline. You assess it every 15 minutes for the first hour. You assess it every 30 minutes for the next 2 hours or until completion. Those are all important things. And you want to stop the transfusion if the patient experiences any systemic effects of like anaphylaxis. You can have an anaphylactic reaction where your immune system destroys the incoming white blood cells. Or red blood cells in this context, and you'll have the systemic symptoms of anaphylaxis, respiratory issues, wheezing, stuff like that. You could also have a hemolytic reaction where your RH factors don't match and your immune system destroys the red blood cells, and that usually manifests with lower back pain because all of the waste from the red blood cells that your body's destroying, your kidneys now have to filter it out. So you want to give them normal saline as well to help dilute that waste so the kidneys can have an easier time excreting it. And then you want to transport all of the supplies back to the lab so they can look at it and culture it to see maybe if there was some type of microbe in the blood already, or something like that.